Hello, my name is Selma, and I'll be guiding you through information about risk assessment and testing for hereditary breast and ovarian cancer. Now, most cases of hereditary breast and ovarian cancer are caused by inherited changes or mutations in two genes, BRCA1 and BRCA2. This video is about the tests you can take to find these mutations. The good news is if you find you have a mutation, there are now effective medical options that can lower the chances of getting breast and ovarian cancer. Knowing if you have hereditary cancer risk empowers you to choose the most appropriate steps to reduce that risk. In this video, you'll meet several women, including myself, who thought we might have hereditary breast and ovarian cancer syndrome, or HBOC, and eventually had testing to find out. You'll learn about the features and cancer risks of hereditary breast and ovarian cancer and hear medical options for people with HBOC syndrome. And we'll cover the benefits and limitations of testing for BRCA1 and BRCA2 mutations to help you determine if testing is right for you. If you or your healthcare provider conclude you might have an inherited risk for breast and ovarian cancer, testing is the most accurate means available to see if you have a BRCA1 or BRCA2 mutation. And knowing if you have a mutation will give you power. For example, my mother died of ovarian cancer in her 50s, and I had breast cancer in my 20s. Now, by the time I was in my 40s, my doctor and I realized I should have the test, and so I did. And ever since I found out I'm a carrier of a mutation, I've taken measures to prevent and combat cancer so that I'm able to be here today to talk with you. Rachel knows she could be carrying a gene mutation because her mother Jane has already tested positive. Rachel decided to be tested so she could use her test results to make important decisions about her health care. We spoke to Rachel and her mother Jane the day before Rachel received her test results. Naturally, both of them were a little apprehensive.
I mean, it'd be nice if my test comes back negative, then I just sort of fall back in with the general population, you know, as far as what my risk is. But if I can find out that if I'm positive and be preventative, maybe do increased surveillance, maybe have the surgery, then that seems reason enough because it'll give me years of living with my family.
Of course, I hope that she has a clean slate and doesn't have it. It would be wonderful to say the buck stops here.
Some women wonder why they would want to know if they have a BRCA1 or BRCA2 mutation. One compelling reason is that there are now many effective medical options to manage the increased cancer risks associated with these mutations. Jane is carrying a mutation, and she and her healthcare providers have increased her surveillance and taken other precautions, and as of today, Jane remains cancer-free.
I have an annual mammography, which I've always done, but it now is tagged and specially read, I think. I have almost every doctor I go to does a breast exam, and I take tamoxifen, which is supposed to be an estrogen inhibitor. And I go and meet periodically with my nurse who advises me and checks me out and so forth. I have a lot more people on my team now, so to speak, than I did before.
If you are at greater risk, you can also increase your surveillance, starting monthly self and clinical breast exams, yearly mammograms, and MRIs at an earlier age, and starting annual or semi-annual transvaginal ultrasound examinations and CA-125 testing as early as age 25. Women with a BRCA1 or BRCA2 mutation can also take prescription medication to reduce their risk of cancer. Drugs such as tamoxifen have been shown to reduce the risk of breast cancer in high-risk women, and oral contraceptives may reduce the risk of ovarian cancer. Now, another option that some women choose is preventive surgery. Preventive mastectomies reduce the risk of breast cancer by at least 90% in women with BRCA1 or BRCA2 mutations. Most women follow preventive mastectomy with breast reconstruction. Preventive removal of the ovaries, which is done after childbearing is complete, significantly reduces both ovarian and breast cancer risk. Lisa's sister was diagnosed with breast cancer at the age of 30 and found out that she had a gene mutation. Now, Lisa was cancer-free when she found out that she had the mutation as well. So after careful consideration of the options for managing her increased cancer risks, including weighing the fact that she was finished having children, Lisa chose preventive surgery to remove her ovaries and both breasts as her personal course of action.
The one thing that the test did for me, in hindsight, that I feel fortunate about is I was able to get the test results having never had a diagnosis of cancer. And hopefully, because of the test result and because of the path that I've chosen, I will never get a diagnosis of cancer. And if that's what comes from it, then I feel very blessed. I don't ever go to bed worrying about cancer. I don't ever wake up worrying about cancer. I really just pretty much lead my life worry-free, which for me, you can't put a price tag on.
If you are concerned about your chance of having hereditary cancer, there are several steps you can take. First, you should have your healthcare provider evaluate your personal and family history of cancer. Things that can increase your chance of having hereditary breast and ovarian cancer syndrome include the following red flags: a family or personal history of breast cancer before age 50, or ovarian cancer at any age, or bilateral breast cancer, or both breast and ovarian cancer, or male breast cancer diagnosed at any age. In addition, your risk could be raised if your family includes a relative with a previously identified BRCA mutation, or if your family is of Ashkenazi, Eastern European Jewish descent. However, please keep in mind that BRCA mutations are found in all ethnic groups.